So, Kieran, thanks so much for joining me.
Yeah, thanks for having me. Well, my name is Kieran Wallace. I am a HCPC registered physiotherapist. Currently work in private MSK practice as a senior MSK physiotherapist. I am a head physiotherapist at Watsonians Rugby Club, and I'm also head of medical at University of Edinburgh Rugby Club.
So let's talk through what type of typical patients are you seeing at the moment?
At the moment, I've got quite a lot of mechanical lower back, postural, kind of cervical thoracic kind of patients that have that really kind of rounded kyphotic posture from like years and years of just sedentary positioning. So majority of the people that we do come across in clinic at the moment do have that kind of rounded shoulder posture, kind of forward head tilt, not really kind of aware of their body in space and time.
Yeah.
So it's really more of like the proprioceptive kind of care within movement and lack thereof as well, because older kind of clientele that we do have in kind of anywhere from 50, 45 and up really, we do tend to have that kind of like avoidance of movement as well. So these kind of clients, they're not really used to moving. They've seen a kind of influx in people wanting to train more. You've got all these new kind of nice guidelines that are coming in saying strength training is like the forefront of what you should be doing rather than just being active for 120 minutes a day or 150 minutes a day. So there's a huge variableness of the kind of patients that we do come across, but majority of them would be that kind of mechanical spinal issues that we do get. Quite heavy on the lower backs at the moment. That seems to be the kind of bread and butter of what we're seeing in clinic at the moment as well.
So I think this fits in nicely to obviously the reason why we've came together to have this discussion. The lack of education and the lack of support around what you should be doing and what you really shouldn't be doing when it comes to resistance training. And looking at that longevity part and that lifespan part, not just physical activity where you just go in and we're just going to lift. So the reason I think is when I've got my clients or my patients or even the corporate women that I'm working with at the minute, the lack of knowledge and support around thoracic extension, their hip hinge, because they are in a sedentary lifestyle most of their day. So when I'm in that consultation piece and I'm going, right, okay, so, are you active? Are you sedentary? Like, you'll find you do have that round of the shoulders, limited core stability, that hip hinge movement is not there. And then I was on a podcast talk with one of my clinicians that I was working with last week, and she was saying the exact same, that the people that find they can fall over very easily, they don't have the stability and the way they should in their 45, 50, 55. So we are starting to see it a lot earlier.
Yeah.
Rather than you thinking it's an elderly patient in their 60s, 70s, 80s that is falling over at home. It's getting younger.
And that's the kind of main issue that we're coming across is the lack of control, and it's a lack of training throughout their younger years as well. Like you said it greatly there, that we have that really sedentary behaviours within, especially now that especially women are actually going into the workplace a lot earlier now, because the traditional mindset of having husbands working and the women at home, that's completely shifted now. So you do have a lot more kind of females being very, very active in their jobs, either that being corporate, like you say, whether it's working in retail, whether it's working in hospitality, you do have that huge influx of people that are working so much more. But then as we're moving into that reintegration of exercise and reintegration of movement, lack of knowledge is a huge component of it, because people just think they can just jump on a 5k run and not have any issues whatsoever, and then all of a sudden they can come up with like kind of stress fracture symptoms within their lower backs. They can have real big issues within the hips because the hips haven't been used to moving for so long, and then all of a sudden you've got this like reintroduction of quite a high spike in load, and then all of a sudden they're just back to basically square zero and not being able to move again. And then it introduces them into that fear of moving and the fear of kind of actually going into loading, because loading is such like a huge important part of physio that it goes unnoticed for such a long time until it does become a problem.
Mm-hmm.
But like, you've got sarcopenia. As soon as you hit the age of like 55,
Yes.
60,
Mm-hmm.
the rate of that just skyrockets, and then
Mm-hmm.
your risk then of further tissue loss, further like maybe even some connective tissue disorders as well. But like, it's not very often that it does come apart unless they've got any underlying health conditions.
Mm-hmm.
But with the kind of older generation, it just seems to be kind of spike, reduce, and it just doesn't actually improve anything. There's no linear progression to anything that they're really doing. It just seems to be like boom bust, which is a huge component of physio as well as like movement in general. Like, you'll see it a lot with some of your clients and some of your patients that you have as well, that they do that little bit extra because they feel good,
Yeah.
and then all of a sudden
Yeah.
they're right back.
I think I have a lot of straight out the gate. So, we've either had a health scare or we've had something that might, I probably should start exercising, or I really need to take more care of myself. And then they go straight out the gate. Like you said, someone who hasn't done exercise for a very long time then decides to move quite quickly, going in, I'll just start a 3K, I'll just start a 5K. The impact on hips, knees, ankles, joints, they don't have the biomechanics properly of their hips because they're in that sedentary lifestyle, and then they're going out and they're absolutely tearing up the pavement. And then I'm coming in with I've got this and I've got that, and they've got progressive problems over and over. And then that's obviously where I'm going out of my scope of practice. I'm referring to someone like you, and then you're doing the assessment for me, and it's coming back to me going, right, okay, we need to strip this back to basics. So
Yeah.
that's why I think anybody who's listened to this probably wouldn't know, but they will now. Over the last 12 months, me and you have been working together to build up a care pathway for any clients or any patients that we have. So, for example, if I'm having corporate women I've predominantly corporate women, but I have a few men as well. But at the minute, with my new business model, predominantly corporate women in a sedentary lifestyle, not moving often enough, doesn't know how to use that hip hinge. We call it dead butt, where those muscle fibers are not firing anymore in the hips. And that's why, if I'm having that stability issues, I'm referring to you, you're doing an assessment, or they've already had an injury, completely out of my scope of practice. You're going to get I'm going to get a second opinion, like a professional opinion, and then you're going to refer back to me and what the next steps is for that client.
Yeah, so that's where this kind of referral system in the care pathway works really, really well, because about maybe 30 or 40% of the information I give over to clients and patients that I see actually gets absorbed, and that's a vastly different component of physio as well, because you can only give what the patient does receive.
Exactly.
And if you overload them with far too much information on the front, like we do sessions over an hour for the first appointment, and you're basically spraying all this information, but then you have to really, really dial it back. But that's where the pathway that we've kind of developed for, especially for your clients as well, it's far more streamlined.
Yeah.
So it was really, really streamlined, because it just makes that kind of like, what's the word I'm looking for? It's the coercion of care. So I don't just go, do as I say.
Exactly, yeah.
Crack on. It's more of like, right, this is what I'm thinking. This is what I would normally give. Is there anything that you would kind of suggest for?
Exactly.
But physios are very, very limited within the kind of exercise prescription pathway. I'm very, very fortunate, because of the pathway that I took into physio was through decent level rugby. It came through working in private practices, like multiple private practices, as shadowing, doing like different bits of sports massage, not exactly gathering a huge amount of information, but you see how all these other clinicians work. And then you pick all these little different bits of information from the kind of 10 to 20 different clinicians that you see, and you're like, oh, that's a good thing to add.
That will work, yeah.
That's a good
so
thing
nuggets
to
of information that can just support your client in the future, yeah.
Exactly, and that's where I feel like I've been very, very fortunate as well, for the people that I've surrounded myself in at such a young age into this profession as well, because I've had a huge amount of support for that, and it's made my life a hell of a lot easier in the easiest way possible. But that kind of like conversing about the patients is a massive component of it, because if they don't want to get better, or they don't have the guidance,
Exactly.
they just they don't get better, because I'll be the first one to say that rehab is not fun.
Yeah.
Like,
No, I agree. I
and
agree.
the difficult thing is that rehab, there is an essence of it being difficult, and it's very, very frustrating, and it can be a very kind of like a rising tide floats all boats kind of thing, where it does kind of work in essence of timelines, but if you really want to kind of like speed things up, you want to get the best chance at recovery, best chance at nutrition, that this is where you come in really nicely, because my scope of practice is physiotherapy, whereas
Yeah.
you as a coach, you're able to kind of like give that advice and give that kind of push forward for them. And that, again, that makes my life a hell of a lot easier, which is why this care pathway works very, very well.
I think that's why I wanted like full system health. So obviously with my background and the patients that I cared for before I changed my career, it's important that you're not just a coach, you're there for their longevity. You're there for their lifespan. It's not just about fat loss. I think there's so much around at the minute. It's just all about fat loss and GLP-1s and peptides. I understand that there is a part to play if someone has a medical condition that needs to be addressed.
Yeah.
But I think when, like for example, the care pathway we've created, I've got sedentary women that are predominantly overweight, drinking too much alcohol, not moving often enough. If they have an injury or something happens and I refer to you and you refer back to me, there's a high probability that they will be able to recover well, because I am reinforcing that accountability on my part when they're seeing me in their sessions or when I'm writing up their prescription for what they need.
Yeah.
But if you leave a sedentary woman who doesn't move often anyway, and then you say, oh, by the way, you got to do your stretches and you've got to rehab that shoulder, and here's like these mobility exercises that you're going to do, there's a high probability she is not going to execute them. But if she has someone like me and you together with that level of accountability between us, then we're going to get further forward in her care and get her back to a position where she's fully functional, rather than it just being left to her own devices.
Well, this is where like the habit building is such like a huge component of it as well.
yeah.
Because like you say, like I enjoy a glass of wine or a glass of
100%.
gin after
Yeah,
a long
a long
day, or a
day.
beer or whatever else that you want, whatever your vice is. Like if you've had a long day, you tend to opt for that kind of dopamine hit.
Exactly.
And
yeah.
the more that you kind of strive for that and strive for that dopamine hit, it counteracts the body's ability to heal. So if you have alcohol in your system, you're far less likely to heal at the consistency timeline. So
Yeah.
we're already working on the back foot.
Yeah.
If there's a high alcohol intake, or if there's binge eating behaviours, if there's stuff like that where they're not getting that consistent nutrition within their programming, within their own kind of lifestyle, because if they're, because we had discussed this quite a while ago actually, where it's like they skip breakfast, skip lunch and have a big dinner.
Yeah, I talked about this the other day.
And it's such a counterproductive method, because you're just like, oh, just have a big dinner. So you're going to like flood all of your system with all these nutrients that they don't know what to do because they've just been starved for so long.
And it doesn't be absorbed correctly. Like there's only so much protein the body will take within a specific time frame. So you trying to cram 30, 40, 50 grams in a smaller window doesn't work well for recovery, doesn't work well for anything that we're trying to promote in terms of longevity, recovery, like, what you do with patients, what I'm trying to do. Like I said, I was recording last week with a clinician, a geriatrician from the hospital who is my client, and we talked about like reactive prescribing, for example. People have been prescribed high volumes of medication that is like polypharmacy, so they're on 6+ medications already, whereas me and you are like creating something that is more holistic approach to care, looking at lifestyle behavioral patterns that they can adopt, rather than, oh, here we've got a problem, here is a tablet. It's just take that, and that's going to take you for chronic pain or acute pain that's turned into chronic pain before they see someone like you.
Yeah, and I
It's
think
like-
that's just such a huge component of like I would much rather see somebody at the acute stage.
Yes.
Like acute management of injuries it's a breeze
Yes,
to deal with,
yes.
rather than when you get into that chronic side of things.
pain.
It's difficult.
Yeah.
It's really, really difficult, because there's loads of the biopsychosocial metrics that you need to take into consideration. High stress job,
Yes.
sleep quality, family life. Is there any other kind of stressors that they have that we need to kind of go, oh, right, maybe my scope of practice as a physio is to kind of
Yeah.
push you towards maybe other methods of care that would actually benefit you. Because it's
Exactly.
not always going to be just as simple as here's a tablet, take it, or
Exactly.
here's this kind of stretch for your lower back, or here's the stretch for your hamstrings. That should make it better, because if you're dealing with chronic fatigue, it's the hugely hypersensitive kind of pain receptors that are causing this, and the pain is very, very real.
Yeah. Yeah.
And
Definitely.
I think there's a huge misinterpretation within chronic pain, like your fibromyalgias and stuff like that. There's a huge component that's missing because there's just not enough understanding. There's not enough kind of literature backing like, oh, this is what's going on. It's just
Yes.
the surface level understanding that we do have of chronic pain and chronic fatigues is that it's just not understood.
Yeah.
And
And I think that's what you touched on there. When I was speaking with my client last week, we were saying like the main chronic diseases or that acute illness that has already got to her stage is those inflammation markers.
yeah,
We've got a level of inflammation that has occurred somewhere. Now, whether that be unmanaged pain, like they've had an injury, they've had a problem, or those higher levels of cortisol level that is creating that constant inflammation in their body 10 hours a day, 12 hours a day, where there's no drop in cortisol and it's not being managed. And that's from high pressured environments, again, corporate women or anybody who's got a higher level of responsibility.
yeah,
Like when I'm coaching my clients and I'm like, right, we need to look at full system health because, like you said, it's not as simple as here's a tablet because this is a problem. Even though Western medication and doctors have us in medical school, this is what the problem is. This is what you can have as a prescription.
yeah,
There's no other, because they're just taught that way, whereas we're looking at things that are bigger picture to help them long term rather than just looking at a quick fix.
yeah.
Because that's what today's society is, right? Everything's a quick fix.
Yeah, and I'd actually kind of listened to like a really interesting podcast, or I think it was Dr. Sarah Hill. So she does more of the hormone aspect of things. But she was discussing about you can either drive there or you can walk.
Yes.
So driving there, you're at a bit higher risk of getting in a crash or something happens along the road. Walking, it's a lot slower, however, it's a safer pathway.
Yes.
So there's all those kind of aspects of yes, it's a quick fix. However, that's the alternative is a much, much longer route, but it's safer.
And I think that's what the problem is in today's society.
Yeah.
If you know, an example, if I'm programming for a client and the realistic expectation of the client versus reality of what it will take for them to get to what they see. So they might say to me, okay, I'm going on holidays in 2 weeks and I need to drop this, I need to do that. And I'm like, that's not realistic. You've got multiple X, Y, and Z. This needs to be addressed. It is a long game.
Yeah.
It's like when women, you're strength training, right? It's delayed gratification. We're not going to build guns like yours and get muscly like me, shoulders like mine, and guns like yours in a short form time. We've spent time, delayed time, gratification in ourselves for us to be able to achieve that result. But people love to
Short term.
What could you do for me
What could get me
today?
there quicker?
What can get me there quicker? Instead of having to go through the things that are uncomfortable, that uncover parts of themselves they may not want to identify. Like it's a bigger picture in terms of health.
Yeah, and it's really about like kind of appropriate goal setting as well,
Yes.
because for physios we have to kind of sit down and kind of get a gauge of like where patient expects themselves to be in X amount of time.
Yes.
And we have to also be the bit of a bearer of bad news and just like, realistically, we're probably looking at, instead of it being in a 4-week time scale, we're probably looking at 12, 16, 18 weeks.
Exactly.
With consistency of work, with all the habits that we're building in. Like it needs to be like a blocked and scaled, phased plan,
Yes.
rather than just being, okay, you're going to do this for 4 weeks and you're going to be brand new. And I think that's what people want to hear. And that's the really, I don't want to say frustrating. It's not frustrating at all, because it's more so it's like it's a tougher road around to kind of discuss with somebody and get those like SMART goals planned in. So they need to be specific, they need to be measurable, they need to be attainable.
Exactly.
They need to be time constrained, they need to be realistic. Like you have to, really, really work with the patient to get them to their goals, because if I don't share the same goals as my patient is, if I'm not really, really keen to get them there, they don't buy in.
Exactly.
And it's the buy-in that creates these results. And that's
They've already got limited beliefs in themselves that they're going to be able to get to a point where they're pain free.
exactly.
Because we wanted to talk about the avoidance style.
Yeah.
Our faces
It's
say
a
it
good
all,
one.
right? It is a good one, right?
Yeah.
Because I've experienced it, you experienced it. So anybody listening to this is going to get a real picture of what we see. So avoidance style, I would have clients or not just obviously corporate women, because I'm coaching a wide variety of people at the minute. But I may have someone who has had an injury or an issue that has occurred multiple years ago. So we're talking like back in NAM, right?
Yeah.
And I've done an assessment, we do a biomechanical assessment, check them out, see what's going on. And they would say, no, Amy, I can't. What's your experience on this?
Flat out refusal is probably the best
Yeah.
one. Yeah.
Amy, I can't do that step up.
The
I just can't.
the main one that we see is if we've got some form of history of sciatic nerve pain or
Yes.
lower back pain with associated leg pain. So they may have done it deadlifting, they may have done it bending over, they may have done it twisting to pick up their child, they may have done it feeding the child. And then all of a sudden it's just that, oh, I'm not doing that because it replicated that. So
Yes.
it's almost that kind of trauma of like, oh my God, this had a huge impact on my life for 6 months.
Yeah.
I'm never, ever, ever doing that again.
Yeah.
But that's totally fine, because you're allowed to feel like that. You're allowed to
Oh,
have that fear
definitely.
avoidance of that movement.
Yeah.
But in order for your back to get better, it has to be exposed to some form of a hugely regressed model of that to be able to build you back up
Yeah.
to that stage. Now, whether that's been somebody ripping a 300 kilo deadlift, we see them in clinic. We see the big strong men, we see the power lifters, we see bodybuilders, we see just about everyone you can think of. The main ones that we actually come across that have these really, really sensitized backs is the sedentary 50 plus. We very
Right up my
rarely
street.
we very rarely see the kind of like high level athletes that have got these like really, really sensitized nerves within their back because they're conditioned for it.
Exactly.
And they've been conditioned for that for years and years and years. Whereas these people social media is such a bad thing as well for like that kind of generation to like look at as like, oh, there's a 40-year-old deadlifting 400 kilos.
Yes.
And you're like, oh, wow, I can probably do that.
Yeah.
If I really set my heart to. Realistic as well. Like,
Yeah.
but there'll be people that go in and go, I'm just going to try deadlift, squat, and bench.
Yes.
Those are my 3 main movements. I'm going to do that 4 times a week, and I'm going to get really, really strong. Doesn't necessarily work like that because your joints aren't conditioned for it. Your back's not conditioned for it. That compressive load, especially in deadlifts, like
Yes.
you have to be conditioned for that. Your paraspinal muscles within your lumbar, within your thoracic, they all have to be conditioned to withstand that load. If you just went and grabbed like half a ton, you're going to fold.
Yeah, exactly.
And it's just, you're just going to be like an accordion, just squish. But this is like the misinterpretation of like achievable goals for people, because that kind of age group coming through to be non-mobile, to then have a goal to be the most mobile that they've ever been, it needs to be phased. And again, the care pathway that we have is like phased, acute, subacute, into kind of retolerance, into then return to sport and into performance.
And I think that's because I say this time and time again, and I do this with all of my clients, no matter who I'm coaching at that time. So load is not always better. We've talked about this. So just if you're a coach out there and you come across this, load isn't always better. When I'm coaching my clients and I'm looking at the way we only program to their ability, we meet the client where they are. Deadlifting and getting stronger, obviously we want that long term, but if they're not in a position to deadlift, if they've, or they're not in a position to back squat, then we look at something that is a better progressive to that, to get them to that. But I find a lot of people that if we're just jumping straight in there with, oh well, I know my compound, so we'll just give them a deadlift, a back squat, a bench, and like the programming for a full body workout as such, I get that. But a lot of people that I see, they cannot do this.
Yeah.
So if I'm going in to give them a back squat, like they can't put their hands to their back because they're in a sedentary lifestyle where their shoulders are so internally rotated. They don't have any stability in their core. There's no way they're getting their hands even to that point for them to be able
the
to.
lack of thoracic extension there as well,
Yeah.
because of that position for such a
So
long
there's
time.
no way that they're going to be able to do that movement pattern. Yet, again, we see time and time again, people are pushing these movement patterns because they don't know any different, or they don't have the knowledge and experience, or they're not spending enough time educating themselves on how they should be programming for a specific client, or they're not exposed to it. They haven't got they've just had,
Go to the gym for a few weeks, enjoy it.
Yeah, they have I don't know, Sherry, who just wants to lose half a stone and
Just feel better.
Yeah, feel better. Yeah, there's a big difference between sports performance and how someone moves and how we can make them better versus loading deadlifts and
There's
understanding
so many better options for
Yeah.
people as well. Like, just to name a few, you don't really see many of the elite sports now doing conventional deadlift
No.
at all, because they all use trap bar or they'll use a safety bar,
Yeah.
and they'll do like some form of zercher squat.
Yeah.
There's not really like a huge necessity, unless you're a power lifter, unless you're a strongman, to do those. Like, I wouldn't look at a kind of sedentary person and go, I'm going to chuck you on conventional deadlift, back squat, and bench, because I know that they're not going to be able to do it. And they're going to hate it. And they're going to hate the fact that they can't do it, because they come to me in a position of trust. Like, like, I'll see people at their absolute worst of the worst. And they're so down about how they can't move, they can't function, they barely get upstairs without being in pain. You reintegrate them to it, they feel a lot better. That's great. But if kind of people are freeballing it and then just not really looking at like the individual itself, it's really difficult to see, because you have these people that feel like they're doing really, really well, but long term, they're probably actually doing themselves a disservice as well.
More damage than what they would when they began. I agree with that.
Yeah. And
I've seen it time and time again. I think you've seen it time and time again as well, even with some of the care pathways that we've created that were clients previously that have now came to me for coaching, and I've referred you for an assessment, and how that looks, because again, you've got people that might be going for heavy deadlifts that are not in a position to be able to do that, who don't have the support to be able to do that type of movement pattern. And I think that we talked about avoidance, and we've talked about there's some exercises that we wouldn't be going in with, and the type of people we see 50 plus, etc., that need more functional, that isn't just loading.
Yeah, and you can argue that deadlifts and bench are conventional if half a house falls down on you and you just push it off. Great, woohoo! But you also have the fact of, if you give somebody a functional movement and they say, oh no, I just want to deadlift, it's like, right, okay, let's try a single leg arabesque, and they're rotated kind of externally at the
I'm laughing
pelvis.
because you know.
Yeah, but it's not as much of like, that was purely hypothetical, but I'm sure that you and I have probably came across people much like that as well. It's more so like, you have a look at that control. Okay, yes, you can deadlift 140 kilos, great, but when your kind of tailbone tucks underneath you,
Yes.
and you're lifting with shrugged shoulders, it's not great.
No.
Like, but these kind of high level power lifters, they take months, years, decades to actually perfect what they're doing.
Exactly.
And it's that kind of 10,000 hours argument of,
Yeah.
of the perfection of your craft. Like, you need to be doing that pretty consistently for years to even get anywhere near being able to. Yes, you could probably safely do it, but it's more so like consistently safely doing it. Because it's like, it's a drop in core brace. Does then that fold you over, does then that kind of tug at the discs? Does it then tug at the nerves? Does the nerve then become irritated? Is there a possibility of a herniated disc? Now, with the herniated discs, it doesn't necessarily mean like surgery. Like I think that's a common misconception with like lower backs especially, is like, oh, I've got a disc like herniation, like I can't do anything. It's like, no, actually you can do a hell of a lot more. You just can't load and aggravate that disc herniation into either if it's compressing or if it's got neural compression or if it's not got neural compression. If it's not got neural compression, great. Decompress, give it a bit of time, do some stretches, do some like unloaded movements. Because the amount of people that you'll see doing like a single leg kind of Bulgarian split squat,
Yeah. And they're not
wobbling
stable,
like a penguin because they can't get the load or can't get the balance.
I'd say, you done that with me? You had swung me upside down, like I hung upside down like a bat. Because I had done a deadlift. And I had, no, actually, I didn't deadlift. That's not true. I done a stretch. I was stretching on the mat before I was going to go and train legs. And I twinged something in my back, like I don't know, it was like a click or something. I remember saying, and I came to, and there was that transferable pain down my right leg.
Yeah, and it was right down the lateral thigh and at the back of the knee.
And then you swung me upside down a couple of times, and
yeah,
it
it was
seemed to
so we
decompress
did a little bit of inversion therapy. So feet underneath the kind of block, directly upside down. Held that kind of three sets, like 1.5 minutes, just to allow that kind of spinal decompression.
Fixed me right up the way.
Yeah, like
Don't
even
have any issues with that
little
now.
things like that, like dead hangs are such a good one for nerve stuff, and like getting the kind of band underneath the legs and just pulling the hips down. Anything with traction.
Yeah.
Anything with traction for nerves is always a good one, especially if you're like constantly being irritated by nerves. But the caveat to that is that if you have a nerve root irritation, likelihood is you can do neural kind of mobility, you can do neural mobilizations, you can do your slump, you can do your passive straight leg raise with leg kicks and stuff like that. Fantastic bits of kit, but sometimes they actually do need an anti-inflammatory to allow it to settle down, because some people they can't function. They can't function with that kind of nerve pain as well, because it's hugely debilitating. Like, just as bad as you were when you came in to clinic with me, you were kind of bent over double and not being able to walk properly. And
like, see, it was keeping me awake at night and everything. I remember if I lay on my right side, the pain was going down and behind my knee, and I was like, what is going on here? And I wasn't even lifting that day. I just was stretching,
Just
and
mobility.
mobility
And it is,
just went, and I was thinking, that's not something that I normally feel, and I knew that something was off. You know?
and that's kind of like maybe 8 times out of 10 what you do tend to find. Like it's never normally like, oh, you can have like your high velocity trauma. That's a given. You'll probably have something wrong there. But it's usually the kind of like coincidental, like, oh, I leaned by the side of the chair there to grab a water bottle and something's just went pop.
Yeah.
It's something as simple as that.
Like, what I find too, like whenever we're doing assessments, and I'd say, I find a lot of people would say to me, Amy, I struggle to reach my seatbelt. Like, I can't get round to get my seatbelt, or, you know, they struggle to put their hands above their head to be able to lift something off a shelf. So when I think I wanted to start Amy, and when we had met and we talked about the care pathway and what was best for our dual approach to patient care, those were things I was really passionate about, because the more women I've seen in that corporate lifestyle, like 40 plus, 50 plus, like can't put your hands above your head at 50.
Yeah.
Can't bend down to tie your shoelaces.
The
These
really
are
annoying
everyday
thing, the really annoying
things.
thing about that as well is the fact that like there is age-related changes that come after age 50. So the really unfortunate thing is women are far more susceptible to getting kind of adhesive capsulitis, so your frozen shoulder, far more susceptible to getting like kind of calcified tendonitis within the shoulder as well. So you've got all of these kind of, and then you've got osteoarthritis as well, which is such a huge component now. And people are trying to beat it by moving more.
Yeah.
Doesn't normally work. Usually it's an age-related change. You can't dance with time.
No, exactly.
And expect to win. Like you're always going to have that kind of aspect of age-related changes as you kind of go down.
Yeah.
But there is far better ways to
manage that now.
Exactly.
Or earlier interventions of care, like what we touched on there, like, are you eating properly? Are you sleeping better? Are you managing your stress? Are you, like, all these pillars of longevity that should be introduced in instead of reactive prescribing, yes, I appreciate someone may need an anti-inflammatory
Yeah.
or may need something, but the bigger picture is you've got a lot more tools available to you, but it comes back to the responsibility of the client to take responsibility for their health, because, you know, 20 years, 30 years down the line, like if you're already in hospital, that we're just keeping you alive with medication at that point. There's not going
Yeah.
to be any, you know, we can't save a chronic illness or or problem or rheumatoid arthritis, or you're fracturing your wrists, your ankles. Things are breaking in simple everyday movement.
Yeah, the really annoying thing is with the kind of rheumatoid conditions as well. So like if you're prone to like your psoriasis, if you're prone to like rheumatoid like arthritis as well, like rheumatoid conditions are such a difficult one to manage because they are inflammatory, they're within the blood. It's You're
Yeah.
going to always have that present. And unfortunately you are far more susceptible unless it's managed properly. Because if it's not managed properly, with medication, yes, as the first kind of port of call to one, deter the symptoms,
Mm-hmm.
but then you've got that holistic approach that we've been like discussing quite often, and it's that management of the symptoms through movement, through behaviors, through diet,
Yeah.
and because we've been at this for quite a while, where we've discussed about how to manage the kind of the flariness of some of these conditions as well. Like
Yeah.
sometimes you can't get away from that, but there is far better ways to offset how many flare ups you have.
Well, I think I've got an example of this. I met someone and I done a consultation with them, and we got deep into conversation with what has kind of happened to them over a 6 month period. And in that time, they're in a very high challenging role, high level responsibility. And they had a bit of kind of like a breakdown as such, like a bit of a quite really high stress level, hitting not burnout as such, but feeling that chronic fatigue, really bad exhaustion. And what came off the back of that was they had rheumatoid arthritis, or they this flare up. And when they had went to their GP, and the GP was like, look, we need to refer you to the hospital and you need to see a specialist, etc. And they got as far as the specialist, and the specialist was like, look, don't worry about it, because we've got a suite of medication that we can prescribe you. And she was on the back foot about this, because she's like, you know, I don't really want to be on this medication. And when it came to it, she ended up going ahead with the medication. And the medication was, which I talked about last week with my doctor, we talked about the medication that was prescribed for kidney function. So the same medication that was used for the arthritis, rheumatoid arthritis, was also connected to kidney function. What happened long term was she had a drop in white blood cell platelets, and she ended up with a second condition that she didn't originally have.
So it's had that knock on effect of,
So she went for, no, this is someone who doesn't move often. He is in a sedentary lifestyle. Who doesn't have that hip hinge biomechanics. Can't, you know, was a dancer for years, and has a lot of knee problems and hip problems, and didn't know how to manage it,
yeah,
and then ended up with this condition, and then has went on to the higher level of stress and inflammation build up in her body from her corporate role,
right,
has then impacted that. And you see how then we went from that, those high inflammation markers and stress, to then having this condition, to then seeing a consultant, to then being on medication, to that medication then connecting to something else. So this is why me and you are talking about that holistic prescribing,
yeah,
and supporting them, because had we been in an intervention earlier, would that have escalated to the point where it has, where now we're in a quite a tricky situation?
yeah. I mean, that kind of stress management is just a huge component of like a knock on effect, because when you've got those like kind of cortisol spikes regularly,
Oh,
like your somatic nervous system just can't take it.
a shot, I know.
And that's when you start getting that kind of maybe a bit of a shaky leg syndrome. You start getting a wee bit
Yeah.
jittery. You can't really, you're not hungry, so your dopamine's all gone. So you're not actually receiving
Yes.
the dopamine to actually make you feel better, because then it just ends up just being a very quick downward
Spiral.
spiral from there. Whereas like in that example, an early intervention of okay, maybe let's have a look at the kind of stress management first. How do we manage that? Okay, you're fairly successful. We can't really kind of strip you off of your job because that's
Exactly.
just an unrealistic kind of cause of treatment. It would be having an outlet. So having
Yes.
your outlet would be having your coach to refer back to, having the diet to refer back to,
Exactly.
of not eating 6, 7, 8 hours.
Yeah.
I'm struggling now. Okay,
Yeah.
back to basics. Let's get back onto the kind of nutrition. Right, nutrition's back on track.
Because
Fluids are on track.
because I with my client last week as well, when we were talking about like that gut microbiome and access and connection of how your body feels and the nutrition that you give it, that was real, because you can use anti-inflammatory properties in food sources.
Yeah.
Like turmeric, anti-inflammatory properties in pineapple. Like we've got things that are available that doesn't necessarily have to be straight to medication. But again, because we're conditioned in a society where quick fix means we can prescribe, I get that. But you know, if we looked at nutrition, is there a way that we could help with that anti-inflammatory flare up with different food sources?
Yeah, and
So
I
then
think
that's
that's where kind of Western culture is really on the back foot for it because
yeah,
I mean you look at people in Italy,
yeah,
Mediterranean diets absolutely
yeah.
works a treat for them. Regular sun, I know we don't really get that in Scotland much, but
Yeah, I know,
we
but
get two
like
weeks of it in May,
exogenous.
but that's about it.
But
But
indeed,
like you don't really see these humongous like health deficits within those kind of populations, but you look at the Western diet, it's highly processed food.
yeah,
It's highly accessible food,
yeah, cheaper.
cheaper, and like how many times have you went to the shop and you've went to go and get the healthier options? You went to go and get the fruit.
Yeah, yeah,
You've went to go get like the protein snacks, and all of a sudden, all of these foods are almost double the price of
exactly.
a
Yeah,
wee petit filou
yeah, or
pack of six full of sugar.
yeah, or
Yes,
like going and grabbing like I think actually we talked about this with the in our last discussion with the doctor. The processed foods are cheaper. You can get them in volume. And if you've got a family, for example, and you need to feed everybody, it's a lot cheaper for you to be able to feed your family on that than you saying, look, we're going to have fresh fruit and vegetables, we're going organic, we're going to do X, Y, Z.
yeah,
Because then you know, are you in a position to be able to actually feed for your family, because it can be more
yeah, it's
expensive,
that knock
and
on, isn't
that's a
it?
whole different ball game that we could get into. But just for the purposes of
Yeah,
reducing inflammation, there is other ways. Again, back to that holistic prescribing and those pillars of longevity and lifespan, we do have options, but it's up to the level of responsibility of the client and the patient to take direction and follow through on setting new habits.
yeah. So that's one of the things that I kind of implement pretty quickly
Same.
within the patients that I see,
Yeah.
and you kind of deep dive into diet, how much food they're taking on. The
Yeah.
majority of, especially kind of like the adult women, they don't eat enough.
No, no, no,
They
no,
do
no.
not take the nutrients that.
No.
But this is all anecdotal from kind of the people that I have had in clinic, and
Yeah.
you speak to them and you're like, right, how many kind of protein kind of servings do you have a day? Have an egg in the morning, and it's
No, that's even good, because I would have a black coffee. That's it. So I'd be like, right. So we don't need anything. No, we don't have time. I don't. So I was straight into my first meeting. Don't have time. You know, using that caffeine to get through, and then that's it. You know, might be lucky if I stop for lunch, because if someone's put a meeting in their diary,
they have to attend.
like they just attend, they get sent an invite, or they have to oversee something. So the per time management, then they end up putting themselves on the back foot of their own health and well being at the detriment of their success in their career.
Yeah, and it's such a difficult one. Like I've even struggled with that myself, where like you're balancing working in clinic, you're balancing working at rugby clubs, you're balancing working like outside
Yeah.
of the kind of clinic and doing kind of meetings and stuff like that, meeting with surgeons, meeting with other clinics, meeting with doing like loads and loads of things. Like I miss 2 or 3 meal timings, and I'm a zombie,
Yeah.
and
Oh,
I know that I'm
you
suffering.
are preaching to the converted. See, if I am coaching and I haven't had a break and I've got clients back to back, or I am on a call or something's happening, See if I haven't ate within that timing, I go hypoglycemic. I start to I feel like my blood
Yeah.
sugar drops and I start to shake.
Shake.
I feel quite unwell. Like mine actually, because obviously in an ex-bodybuilder, I used to feed my metabolism a little bit often across my day to
Yep.
allow fat loss to keep my cortisol levels
Body gets
low.
used to that.
Body gets used to the rhythm. See, then you skip a meal and you're not feeding the way you used to. I'm like a zombie. I feel terrible.
And if you say to somebody if they're not valuing their own health over the success, it's very difficult to try and sway them towards the longevity and the health aspect of things because they're so hyper fixated on this, like go 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 go. I need to be
Yeah.
busy, need to be busy, need to be busy. That's absolutely fine. But if someone cuts your leg off tomorrow, how much would you pay for it back? And then
Exactly.
normally someone would say, "Oh, millions." It's
Yeah,
like, well,
yeah.
instead of that leg coming off, you could have just done X, Y, and Z over the course of this period of
Yes.
time, and it wouldn't have to come off.
Yeah.
And that's a very extreme approach. But the way that I kind of word it within the clinic and the patients that I speak to is, if someone was to pop both legs off and you weren't able to walk and you were wheelchair bound, you would be doing your absolute utmost to be able to afford to get those legs back. And normally that kind of puts it into perspective. Or if you put it into money perspective, that's always a huge
Yes.
component for especially like corporate women and
Yeah,
corporate
yeah,
like
yeah. When we
people.
talk in targets and figures and KPIs,
Yeah,
it's more relatable. I totally get it. And whenever I was speaking with the doctor last week, she was saying a lot of people, they're already in the hospital and then they're like, oh, we need to make a change. They've already taken a heart attack at 50.
yeah.
They're now on a statin. They're now on high blood pressure medication. They're on hypertensives. Like these things have happened and then like, oh, I actually need to do something about this. But we're already at that stage. Whereas
What stage does then the intervention come before that? That's the
yeah, and that's the thing. But it's like, and I think for corporate women or for anybody, it's very much like, oh, it's fine. It's fine.
a bash
Like,
rod.
yeah,
Bash rod.
we'll just bash on it and we'll get it done and it's fine. But they don't realize that that comes at a detriment, not right now in the present moment, but let's go 5, 6, 10 years down
Yeah.
the line to then be like, oh, actually, oh, I've got high blood pressure. Wonder where that happened. I never got that checked. And I was always very highly stressed. And then we're back into the whole prescribing, yada, yada,
Cycle.
yada, side effects of polypharmacy and all the things. And I find that's what's happening earlier on. I have clients that are, even late 40s. And I'm going, late 40s, and we're already on three
Copious
meds.
amounts.
Three meds. And we don't walk and we don't it's just constant and it's very, very high pressured stress environments is what I'm finding. And last week when me and Deepa was talking on a recording, she was saying like some of the people that she sees, the most common is middle-aged men.
Yeah.
Are you going to agree? Middle-aged men. So we're talking bankers, we're
Yeah.
talking finance, we're talking IT, we're talking someone with barristers. We're talking like men in that middle age are dropping younger.
Yeah.
And they're, I don't know, I don't even know how to approach
I
that.
think
You'll know better than me, but she's saying that's where it's starting. We've got those late 40s, early 50s, and we've taken a stroke.
yeah. It's the work till you drop. That's the
Yeah.
it's the kind of be a man, work harder
Yeah.
kind of attitude, especially for it's a bit different now for younger males. I think younger men at the moment are far more in tune with the kind of this is a bit too much for me now. I need to take a wee step back.
Yeah.
Whereas in that generation, it was just like you would get a slap on the back, tell it to get on with it.
Yeah.
But that's where they go, like you say, work till they drop, and it's that they have the stroke or they have the myocardial infarction when they're so young, and then they come in to clinic because they've got X, Y, and Z amount, but they're on cardiology, they're on rheumatology, they're on kind of neurology as well.
They're under the care of a specialist already in that late 40s, early 50s. And, I'm already seeing someone at the hospital for that. And you're thinking, right, we're already halfway there. We're already in those stages of you're already at the hospital. So all we can do is try to support you the best way we can. But how
Let's just
far's
get
too
sorted
far?
first.
Yeah.
Yeah.
Exactly.
And like that's another one that I'll kind of say within the clinic as well. It's like I've not got time to do all
Oh,
of this.
I hear this all the time.
And I can imagine it's probably a hell of a lot worse for yourself, but I've not got time to be doing half an hour of rehab.
Yeah.
Cool. Come back when you can.
I can't do 12,000 steps a day. It's too much. Right. Let's start at like 8.
Yeah.
8's too much.
Titrate up. Yeah.
Like 8's too much. Right. Let's start at 3. Okay.
Yeah.
That's more manageable.
And then
And
you
it-
probably find that they're doing 4.5 anyway when they start actually tracking it properly, because like
Yeah,
it's such
there's
a
just that accountability piece in coaching is really interesting because I would say 9 times out of 10 you're coaching their mindset shift on themselves, in their belief system,
completely
in their
agree.
fear factors, in their everything about themselves. You're nearly changing them as a whole in what they believe they can achieve, rather than telling them to drink water every day, which is also a part of it as well, don't get me wrong.
But that's also like the really kind of like the motivating factor of being in the profession that I'm in, is that you do get the people that come in after like a block of physio and they're like, I've finally been able to do this.
Yes.
And I'm finally able to do this, or I'm pain free for the first time in God knows how long.
Yes.
And some of the people that I'll get, they'll have seen maybe 4, 5, 6 different physios before me, and nobody's ever helped me. So I'm already on the back foot of possibly some really negative input from
There's
other
no
people.
trust there.
Yeah, and it's really difficult, and it's maybe not with physios themselves. It's maybe they've had a bad meeting with their GP who's told them something that they maybe don't want to hear, and then they've been to somebody else and they've told them similar things, and by the time that they get to me, they're already in this kind of like
Negative.
caged mindset of like, you can't help me.
Because
I
no
don't
one,
know why
no,
I'm
I've
here.
already been to multiple professionals about this, and it's already. I'm starting to, believe that this is just going to be it. I never
Yeah.
thought I could be anything but what this is now in chronic pain state. Or
You'll hear that pretty much every day
Yeah,
as well.
I've
But
heard
the really fortunate thing is with physios, and like the physiotherapy profession is such an inspiring kind of place to be, because you talk to different physios and you kind of share all these really, really similar experiences of like
yeah,
patients not thinking that anybody would be able to help them, and then all of a sudden they have, and then it's
yeah.
just changed it. And that's the kind of motivating factor behind doing what I do as well, because it's really, really reassuring to
yeah.
kind of have somebody coming in and go, oh, that was great.
Yeah.
And it's like, it's
I
nice.
think that's really similar to obviously me coaching, because see when you've got someone that they've got limited beliefs in their ability that they can,
Yeah.
and then you expose them that they done like their first step up, or they done their first lift, and they go, wow, Amy, I never ever thought that I would be able to do this. And they're so like amazed at what they've been able to achieve and accomplish.
Yeah.
And I think that is like, money can't buy that feeling.
No.
Like there's just something about because we're both in that line of work where we're serving others and making other people's lives better and improving their health, and improving, going out of our way to make them as best version of themselves. And I think
Yeah.
that's just so rewarding in itself,
But
because
that's where it's like, it's nice to see firsthand, because you'll have like, I'll see people like post total knee replacement,
yeah,
for example, and this is such a common one, or total hip replacements that have
Yeah.
came in more recently, especially with, I wouldn't really say it's like an epidemic of osteoarthritis, because it happens anyway. Like it's always going to happen. But I think, going off what you had said about GLP-1s just earlier on there, it's more accessible.
yeah,
And whether it's grey market or if they're actually getting it through their GP like they should be, like the ones that you kind of see in clinic that have got it through their GP do far better
yeah,
than the ones that maybe don't. And I was at like a supper with the surgeons at Spire Hospital. I think it was about 3 months ago now, and I was speaking to one of the hip specialists there, and they had said like the amount of people that are getting hip replacements now is slowly coming down, because there was like a huge trend going up the way up until the introduction of these GLP-1s, and all of a sudden it's just starting to kind of creep down.
right,
But they don't want to be like replacing everybody's hip.
exactly.
And I don't want to be managing everybody's hips as well, because like there's such a complex thing with multiple different movements, multiple different, like, it's, apart from the shoulder, it's probably one of the most mobile joints in the body.
Yeah,
and you've got somebody going in, taking essentially a sledgehammer to it, and then fitting
Yeah.
a brand new hip, and it's sore. Like, I don't know if you've seen many of the clips of the hip replacements or the knee replacements being done.
No.
No
No,
wonder
actually
folk.
I have. I've seen a knee and a hip. I think I've seen a knee and a hip. It's not pleasant,
No,
no.
it's definitely not
No.
pleasant, but then we have to have the understanding of why they're in so much pain afterwards, and we
Yeah.
do, because it's like it. But I think with the increase in technology within surgeries at the moment, it makes my life as a physio so much easier because
Yeah.
it's a lot less traumatic. Whereas even more so now that you have these people losing that excess weight, people are a lot more kind of able to move. They're less painful to move because they're not carrying like 15, 20 kilos more weight than they should
Extra.
do. Because imagine if you were walking around with a sandbag on your shoulder for the majority of the day, you'd be
Yeah,
buggered and everything would be
exactly.
sore.
Yeah,
And that's exactly
definitely.
what this kind of method is, where they lose the bit of weight, they feel better, and they move more, and then it helps with those habits. Whereas if they're just doing it, staying sedentary,
Yeah, they're not. I always say you're building a house on sand,
yeah, got to get the
because
foundations right.
if you don't have the foundations right and you're getting a GLP-1 and you're taking it for a quick fix, you're predominantly putting a plaster over a bullet wound, because there is some level of disconnect between your relationship with food. Like I said this before, if you are someone who is obese or someone who is suffering from like it's directly impacting the quality of your life, and you are type 1, type 2 diabetes, you've got already a medical condition, then GLP-1s is fantastic for that person to have a better quality of life.
Yeah,
But if you're Sandra down the street who just wants to take it from the black market to be able to lose half a stone before her holidays, but has no direct understanding of nutrition, building those healthier habits into their lifestyle, sleep quality, drinking or excessive amounts of alcohol, then I think we're just going to be in a pandemic, of sarcopenia. We're going to have more volumes of muscle loss, even though these people don't have a lot of muscle anyway. We're
yeah,
losing body fat at the same time, and it's just it's not going to do well for hip replacements, knee replacements,
no.
and people coming to see you.
And if you think about the kind of the catabolic nature of this medication as well, like at what stage does it stop taking the kind of muscle tissues away and it starts looking at bone, depending on how active they are? Because if you're not training, if you're not resistance training whilst being on these GLP-1s, like the state in which your body's going to be in after either you finish, because you technically should be cycle on, cycle off
Yeah,
as per some of the guidelines,
yeah,
but if they're going for that really, really quick fix, I'm going to lose 2, 3 stone before my daughter's wedding or whoever's wedding, or you're going on holiday, like you've said, and you're going to do that, and then you go on holiday, you forget to take it, you're then smashing gyros in, you've got all the wine, all the
yes,
margaritas, maybe a couple of
exactly.
packs of cigarettes whilst you're away alongside a social smoke.
Yeah,
All of a sudden you end up with that rebound weight probably worse than the
than
amount
what you started.
that you started with, and then your habits are even worse because you've just came back off a holiday.
And I think they're you can't stay on it forever. So there has to be an exit plan. How are you going to come off this medication gradually? It's like anything. If you're starting something, there has to be a way to come off it.
Yeah,
The problem I have also experienced and seen and heard from clients are like, I can just stay on it. So I'm like, you can't stay on this forever. Like there has to be a point of return where if you if you are building those sustainable healthy habits now, fantastic, because you'll be able to come off it and see significant results, but also have your health and well-being at the forefront of what you're trying to do. Or if you don't, you can't just stay on this medication, even, and I would say it's not prescribed for you, like
no.
unless you're clinically obese, unless you're suffering from
Type 1, type
type
2
1
diabetes,
diabetes.
yeah.
Like this was brought into the market for that. Like I heard someone just saying there's that Wegovy tablet now, so you have a tablet for weight loss, right? Totally get it if you want to take an oral tablet instead of taking an injection. If you are obese, if you're someone who's been diagnosed by a healthcare professional to be able to take this medication that improves your quality of life, I support that 100%.
Yeah.
If you're someone who's just taking it for
Vanity
giggles,
reasons, yeah.
for giggles, and are not strength training, are not looking after your nutrition anyway, you're still eating, you know, high
One big meal a
volumes.
day.
Yeah.
Yeah.
You know, how could anybody sustain energy, recover properly if you're just having, oh, I can't eat breakfast because I feel like, ugh. See, if
I'm
I
gonna
have
be sick.
another
Yeah.
person who says to me, I'm taking Manjaro Wegovy, and I go, right, okay, so I'm not here to judge you in any way, but
Yeah.
I need you to understand there has to be a level of building sustainable, healthy habits for your health. That is what I'm here to support you with, to help you educate what needs to happen around this drug. And I said, the first thing I say to them, are you eating breakfast? Can't, feel sick. Are you
Oh
eating
my
lunch?
God.
No, I don't feel hungry enough to eat lunch. And I'm like, are you eating dinner? Oh, maybe a yogurt. And I'm like, this is like, and this isn't like, this is multiple people across my week. And I'm like,
And is that
where do we go
is that
from here?
alongside like a kind of dietitian manage them as well, or are they just freeballing it?
Free ball.
That's where the kind of conversation where kind of patient education comes in vastly.
Why we decided to talk today?
Yeah,
To put this
exactly.
out here, to
Because
understand that you need
with
to be.
it has to be done one with moderation and with an exit strategy, like you've said. It also needs to be done via healthy habits. And
Yeah, by a healthcare professional, by someone that has diagnosed you
yeah,
and has looked at your medical history, has thought about all the other factors and said, you know what, this is the best care option for you.
yeah,
You should start taking this, and we monitor it until such times you don't need to be on it, but not just someone sold it to me who was a friend of a friend, and I'm now on 5 meg, and I go, yeah, you're on 5, but you haven't been able to eat in 4 days.
it's a tough one.
It is a
Yeah,
tough one.
it's a really tough one because the unfortunate thing is as well when people are coming in with like musculoskeletal issues to the clinic to me, and you ask about kind of past medical history, you ask about drug history as part of our kind of subjective assessment.
Yeah.
Usually, it gets hidden in that aspect
Yeah.
of the assessment because they're either fearful of being judged, like you've said, or they don't want you to think that they're doing something wrong, and they're not necessarily doing anything wrong. It's just have you got the correct pathway and the correct health
Advice and support.
advice and education there to assist you in that, because if you're just freeballing it and then all of a sudden you've got this really really chronic lower back pain because you've been on Manjaro or Wegovy for 9 months and you've not told anyone, and then
There's
all of
no,
a sudden
yeah.
you say because it's evident, you know when people have, because you do get that kind of loss of muscle tissue, and you're like, you've obviously lost quite a lot of weight in recent months. Like, is there any? That's when you ask, is there any other medication that you're taking?
Yeah.
And then it's like, oh, I've actually been on this for this.
Well, I find like I'm quite lucky because they would openly tell me,
Yeah,
and I would be like, you know, I'm not here to judge you. I'm here to support you in the best way I can, which is making sure that you're installing these healthier habits into your lifestyle. Me supporting you with nutrition, understanding and educating you so that you can create an exit strategy from this, and feel healthier and happier and move better, etc. Rather than me saying, oh, you shouldn't be doing that, and that's not because
because they
again,
get
like I
told that
said,
enough.
yeah, and again, like I said, it's not that I think the person shouldn't be doing it. It's, is that the correct care pathway for you? Are you someone who is clinical obese? Are you struggling with mobility every day? Is this something that will improve your quality of life? And you've been seen by a healthcare professional. 100% support that. So the care pathway that we've created between our clients and patients is really important because with me working with corporate clients, in my past job, we had a lot of medical insurance patients. So we, obviously with me being in dentistry, we had a lot of people that would come in with medical insurance that we could cover up to, you know, full restorative health of their teeth, and we can do implants and cosmetic dentistry, etc. And why we have created this together is because obviously you are able to take on patients that have private healthcare.
Yes. So we cover in the clinic everywhere between AXA, Bupa, Speed Medical, HCML, Aviva. We've got like kind of a vast variety of people that we have available through private medical insurances at the clinic that I'm working at.
Yeah.
And the really positive thing about having a boss that supports you as much as I do is that he's happy to kind of give the more difficult and the more complex patients. And that's where I felt like I've developed most as a clinician as well, because it's almost kind of trial by fire, but you also learn quite a lot from these like really complex cases, like your chronic pains, like your older generation, especially like the post-surgery care as well. It's a massive one that we cover, but we cover everything from like an ankle sprain up to like a cervical radiculopathy.
Yeah.
So we cover like a huge variety of conditions, which is like great for learning, but also it's great for things like this where we can kind of pass that pathway over,
That B2B kind of,
and
because
the management of it becomes a hell of a lot easier. And it's a component that we're good at physio, but when you've got people like yourself, Amy, that are in this area for quite a long time, like you said, you've been in dentistry, like that understanding of that healthcare pathway is far more positive for the patient rather than kind of just being told, yep, that's you, good to go,
Yeah, I
see you
think
later.
because obviously we had large volumes of insurance patients that came in. Like I said, we would sign off, the company would approve what can be covered under their policy, and making sure that they can see the correct support and the correct care. That is why I think we're really passionate about this, is because with my background in dentistry and how I've went through that before, my corporate women that I now see, they will have a level of support from their employer, or if they're in a senior leadership position, they get a budget in terms of coaching for their well-being and health. And it's important that is addressed, that can be passed through me as their coach, or sent on to someone like you who can support them from an ankle sprain right up into, like you said, more complex cases, to make sure that they get the correct care, and make sure that they're seeing the experts in that field to support them in the best way that they can, so they can get back into work, or if they're off in sickness because they've had an injury or problem, to getting them back into business. And that can just be passed through their employer.
Yeah, and I think a really important point to make on that is that there's so many people in these positions that have the benefits of working in like a big corporation, that have private healthcare as part of their kind of package deal. They don't use it.
Yeah.
And I think, yes, it's a bit of an excess to pay, but at the same time, would you rather pay the excess, get yourself better, or let it fester and become more and more chronic, become more of an issue, and make it more difficult for the specialist that you're seeing to actually treat you?
Exactly.
Because when you know yourself, when something's too far gone, you're like, oh, there's not really an awful lot I'm going to be able to do in 4 or 5 sessions. Like, we're going to need to look at long-term management here and look at that. Okay, we'll get the symptoms controlled under like 10, 12, 14 weeks.
Yeah.
And then by that point, because this has been such an issue for a long time, we need to then develop that kind of long-term care management plan, where we do pass over to people like yourself. And the majority of people, like I think I've sent a couple of people your way already that one have had bad experiences with PTs as well,
Coaching,
and they just don't trust them.
Yeah.
And you kind of get them into that gym setting, kind of desensitize them, and then make them know that it's okay.
Yeah.
When you get them into that position, like, oh, I can actually do this, and then it just makes that transition over
Far
just
better.
so
I think
smooth.
it's that, like, what is it? Not like customer centric experience, but creating a very smooth transition of care. So they're being seen under private healthcare, if anything, because obviously a GP appointment is just 7 minutes. You can't get to the root cause of something in 7 minutes.
Yep.
But we're in a position that we have the time and they're not paying the full amount. They've got an excess fee. Sometimes even, in leadership coaching, they don't have an excess fee because their full care plan is covered.
Yeah.
Which is really, really good for employers to be able to offer that to their senior leadership team to make sure that they're fit and healthy to lead. Again, a lot of people, hence why I developed Amy, isn't doing that. But, that's what we would like them to do.
Yeah.
But yeah, I just think prevention's better than cure.
Completely agree.